Hi, Dr. John with NBC News on this Facebook Live. It's Friday, August 9th. It's almost the end of the week. We're going into the weekend, but if you're like me and most people, every day is kind of a bit of a Groundhog Day right now. But we are getting through this pandemic, and that's one of the messages I want to give out here. We are getting through this. We're getting through this together, and we will eventually overcome all this, get back to a near normal. But it's going to take a concerted effort on a lot of our parts to do the things we know we need to do in order to keep the pandemic under control. And what I want to do here is go through a few headlines, get deeper into the headlines, and what do they really mean? What's the message for you and yours? And then answer any questions you might have, or as many as I can. So please, if you have questions, they're always fantastic. Go ahead and send your questions our way. We'll go ahead and get to as many of those as we can during the time we have here. But let me start with the headlines. First and foremost are the numbers. And here are the numbers that NBC has come up with for cases and deaths. And these numbers, if you notice different sites, the numbers will be different, but they're all within a few percentages of each other. The reason they're different is the way they're calculated. So some of them get numbers by calling different state agencies who are getting numbers reported from local agencies. Others get them from different types of reporting. The CDC tends to lag behind a little bit because they're looking for more official numbers, and they have hardened criteria they use, and they can't go beyond that criteria. So that's why their numbers might differ than ours or Johns Hopkins or some of the other ones you see out there. But here are NBC's numbers. 4.9 million, a little over 4.9 million cases in the U.S. right now, and unfortunately over 160,000 deaths. So again, 4.9 million cases, 160,000 deaths. The reason I'm bringing that up is because there's a study out of the University of Washington. There's a modeling program out there that has looked at what's going to happen by the end of the year. And they think by the end of the year, we could possibly have 300,000 deaths. Right now we're at 160,000. I think that could go to 300,000 deaths. But, and here's kind of the silver lining on this whole thing, they do believe that if 95%, looking at their modeling, if 95% of us wear masks, simple masks that you can make at home, if 95% of us wear them out and about when we're in public, then that can cut those deaths down by almost 70,000 deaths. And so they're still looking at numbers of deaths going up, but those numbers not being as much as they would be if we didn't wear masks. And so that's a great reason to wear a mask. And what I tell people all the time is the original purpose behind the mask. If you think about the traditional mask, when you close your eyes and you think about a surgical mask, it's that blue rectangular mask that doctors wear in the hospital, nurses wear, healthcare workers wear. That mask was originally made so that we as doctors and nurses didn't cough or sneeze on patients. We didn't pass anything to them. It was not made to protect us so much as it was made to protect our patients. Well, that's the same thing with these masks. For the most part, they're made to protect other people from us. And one thing we know now with the coronavirus is a good percentage of us, anywhere from 30 to 50% of us, could not have symptoms and still be passing on coronavirus. Not even know we're passing on the virus because we don't have any symptoms. And that's just the way this virus has been working over the last 6 or 7 months. So if we wear masks, even if we don't feel bad, we are going to be protecting other people from the possibility that we could be passing it on to them. Now, the reality of it is that wearing a mask also protects us to some extent. Not as much as it protects other people from us, but it does protect us from some extent from those respiratory particles that are out there. So if I'm wearing a mask and you're wearing a mask, then we both have really good protection, especially if we have that social distancing, that 6 feet going on in there. And so again, what they're saying is if 95% of people wear masks between now and the end of the year, then we're going to cut down deaths by up to 70,000 people. And so that 300,000 number, 230,000, which is still more than we want, more than we'd like, but at the same time, it's less than what it potentially could be. But the one thing you do have to realize too is this is a mathematical model. These models changed. If you remember back in April timeframe, March timeframe, these models were coming out fast and furious, and they had numbers all over the place, from 160,000 deaths to 2.2 million deaths. That's because the models are only as good as the input that goes into them. And at the time, the input was only a few months of data that we had. Now we have many more months of data, so those models are getting a bit more accurate. Other models that are being put out by the CDC are showing that by the end of August, we might have 170, 180,000 deaths. And so those deaths are certainly going up. We know they're going to go up. And they follow cases for the most part. So even though cases right now, again, they're 4.9 million cases, we're almost to 5 million cases according to NBC statistics. The more cases we have, the more hospitalizations we're going to get, the more deaths we're going to get, but they're all going to follow in sequence. First you get the cases, then you get the hospitalizations, then you get the deaths. And so the bottom line here being the take-home message, the news you can use, is essentially wearing that mask is important, not just for you, not just for your community people to keep them healthy, but also to save lives. And so when you're out and about, if you're at an organization, if you're at an event, then if you can't social distance, wearing masks is ultra, ultra, ultra important. I can't overemphasize that. But now on to the second headline, which is a lot of people have a question about this, and there's some studies that looked into it. Face shields. A lot of people don't like masks for a variety of reasons, especially if you're in a hot, humid environment. It can be tough, but remember, it's protecting you and others, and it's life-saving, but it can certainly be tough to wear for long periods of time. What about face shields? A lot of people are saying, well, can I just wear that face shield that's basically a plastic shield that goes from the top of the forehead down below the chin? Will that offer me enough protection? Well, if you look at the videos of healthcare providers, what do you normally see? You normally see them in a face shield, but below the face shield, underneath it, is a mask. And there's a reason they do that, because those face shields, even though they do offer you some protection, if somebody's coughing or sneezing in your face, if somebody's breathing those respiratory droplets, that face shield can prevent them coming in right at the front there. But the problem with face shields is the sides and the bottom. So if the sides and the bottom, they're open, those respiratory droplets, especially since now we know that there is some, we think, limited spread through aerosolized droplets, meaning they stay in the air a little bit longer, can get in behind the face mask or the face shield and can get to you that way. So again, face shields in and of themselves don't look like they're as effective as face masks, but more studies are being done. One study has yet to be released, has yet to be peer-reviewed out of Israel. They worked with mannequins, and they basically looked at these mannequins, put face shields on them, put some moisture-sensitive paper over their face, and then had somebody cough or sneeze directly into the face shield. When they did that, they found out that from 2 feet away, 3 feet away, they were as effective as masks. But, and this is the big caveat, when they moved people at a certain angle, just out of the midline, they moved people over and had them cough and sneeze, respiratory droplets all over the face. They got on that moisture-sensitive paper. And so what that's showing again is, yeah, if it's a direct on cough right in the middle of your face, could protect you, but when does that ever really happen? Usually you're angled one way or another, they're shorter than you, they come at an angle, and then it can get into your face. And that's why face masks in and of themselves, they can certainly help, and they certainly keep coronavirus out of your eye, which is a minor way you might be able to get it, but at the same time, they're not as effective as masks. The best combination is a face shield and a mask. But again, we do know that especially hot and humid environments, these can be tough. Luckily, we're in the beginning of August, so a few more months we start getting into cooler weather. So hopefully that'll certainly help out. And then the last headline I want to talk about are the drops in rates of a couple of things. And at first hand, it sounds encouraging, right? Cancer rates have dropped. Cancer diagnosis rates have dropped. Heart attack hospitalization visits have dropped. But the reason they've dropped is because people have not been going to get screening tests. They have not been going to the hospital with heart attacks. So what that means is that because of coronavirus, people have been staying away from getting those screening exams, those medical exams. They've been even staying away and having heart attacks at home instead of going to the hospital. And here's the example with the actual cancer rates. What we found out is 46% overall of cancers, of six types of cancers, including pancreatic, including breast cancers, those have 46% overall drop in those cancer diagnoses since February. But if you look at the different statistics, pancreatic cancers dropped about 25%. Breast cancer, unfortunately, led the group here, have dropped 52%, the diagnosis since February. And what the concern is among experts is that there are people out there who have noticed something, maybe a lump, maybe changes in their breast tissue, or noticed some stomach pain that might be indicative of pancreatic cancer, or other things that might be indicative of other types of cancers, and have ignored them, not gone to the hospital, not gone for a screening test because they're worried about coronavirus. Well, one thing that's going on right now, and the hospitals are making a big push, clinics are making a big push, ERs are making a big push to say, hey, you need to come in if you need medical care, if you need a checkup, if you're having an emergency, if you're having a heart attack, you need to come in because we are doing everything possible to keep you as safe as we can. As a matter of fact, one of the safest environments you can be in, if you need health care, is the hospital, is your clinic. And when you go in there, you'll find out, number one, they separate people who they think are infected, especially infected with COVID, from everybody else. Everybody in there is wearing masks, gowns, maybe face shields, gloves. They're constantly cleaning. It's a safe environment for you to be in to get that medical care you need. The last thing you want to do is be at home if you think you're having a heart attack. And of course, the classic symptoms, chest pain or pressure, shortness of breath, pain goes down into one or both arms, you get pain in the jaw, sweating, maybe nausea or vomiting. If you notice those signs, call 911. You need to get to the hospital immediately. Don't concern yourself about getting coronavirus at the hospital. Take care of your healthcare needs, because heart damage can be deadly. It can be lifelong damaging if it's not deadly. Same thing, obviously, with cancer. The earlier we detect cancer, the easier it is to treat. And so you want to make sure you get those screening tests. Now's the time to go back and start doing that like we did before February, before everything started shutting down again. So again, going over the big headlines here, the numbers, 4.9 million cases, 160,000 deaths. Thought being modeling showing that we could have up to 300,000 deaths by the end of the year. But if we wear masks, 95% of us wear them while we're outside, we can save almost 70,000 people from dying. On top of that, face shields don't work as well as masks, can certainly add something to the masks, but don't work as well as masks do to keep you from getting coronavirus, from breathing in those respiratory droplets. And then cancer rates and heart attack hospitalizations are dropping, but they're not dropping for a good reason. They're dropping because people are avoiding hospitals, are avoiding screening tests because of their fears of coronavirus. Need to go back in, especially if you're having signs or symptoms of a heart attack or a stroke. Call 911. If you're noticing any changes that you think might be cancerous type changes, make sure you get that checked. And if you have a screening exam coming up, call your doctor about getting those screening exams to make sure that everything is okay. The earlier we detect these things, the better off they are, because we're more likely to treat them successfully. So now let me see what kind of questions you guys might have.
How do we know 6 feet is enough for social distancing?
So how do we know 6 feet is enough for social distancing? And part of the reason behind this question is because Europe usually says 3 feet, but at the same time, they are much better at wearing masks than we are. And what we're talking about are respiratory droplets. There's 3 ways you can get coronavirus, basically. One is contact surfaces. And so if somebody coughs or sneezes or breathes on a surface and coronavirus gets on that surface, I touch it, don't wash my hands, and then touch my face, particularly my eyes, my nose, or my mouth, then coronavirus can get into those surfaces and get into my body. That's number one. Number 2 are respiratory droplets, and those are the heavier droplets that come out, and they typically don't go very far. They usually go 2 to 5 feet, and that's why most people are saying 6 feet seems to be a sufficient distance. And what they're trying to do is they're trying to balance okay, let's let you live lives and get at least close to somebody so you can talk to them. You can talk to somebody 6 feet away easily, but at the same time, keep you far enough away to where if they're breathing any respiratory droplets out, that they fall before they get to you. Now, this is not the same as somebody coughing or sneezing, because those droplets can travel up to 15 feet, maybe even longer. So you want to be careful if somebody's coughing or sneezing. And that's why we say wear a mask. It's essentially the equivalent of coughing up when you cough or sneeze. If you have a mask, that takes care of it in that instance. And then the third way are these aerosolized droplets that we're looking at now and we're starting to check into. Now, we don't think the aerosolization of the virus is a big way the virus is spread, but we do think, especially indoors, there's a potential for the aerosolized droplets to spread and get to other people and spread coronavirus that way. And that's why you're hearing, as of late, that ventilation, especially with kids going back to school and businesses opening up, is a huge thing. And recommendations being, let's open windows if we can to get that air flowing through there, fresh air flowing through there. If not, let's look. If we can't do that because some modern buildings don't allow you to open windows, they're just not built that way, then look at your ventilation systems. Make sure you have HEPA filtration, so that HEPA filter can filter out the virus as it's circulating in the air. And they even do things like looking at where to put the teacher as far as where the vents are for the ventilation system. And in one study, they found out if the teacher is right under a vent, the virus spreads much less than if the teacher is on the other side of the room and the vent is on the other side of the room. And that's because of the way the air circulates and the possibility of these aerosolized droplets actually spreading. Now, those theoretically can go more than 6 feet, but we don't think that's a huge issue with the spread of the coronavirus at this point. But it's a bigger issue indoors and outdoors, and that's why you're hearing the recommendations. Outdoors is better than indoors, especially if you have gatherings, but you still want to make sure you do that social distancing, that 6 feet, and wearing of masks. Let me see if there's any other questions.
Should we wear a mask only indoors? Do you recommend wearing masks in the house?
So the question is, should we wear a mask only indoors, and do I recommend wearing a mask in house? And I think the reason in the house, and I think the reason behind this is because of what Dr. Birx, who heads the coronavirus task force, said the other day. And what she said is, if you live, basically it came out in the news that she was recommending that people should be wearing masks indoors. And to a certain extent, that's what she said, but that's not the full story, because what she said was, if you live in a hot spot and you live in a house that's multi-generational, in other words, you have many generations of people living in the house, including the elderly and those with high-risk conditions, then you want to think about wearing a mask around them inside the house, because that could be an issue. You could be spreading it to them, especially with kids going back to school, people going back to work. Those are conditions where they might be bringing coronavirus back into the house, and you need to protect those the ones that are most at risk, the elderly, those with high risk medical conditions. But so she's not recommending everybody wear masks in the house. She's just saying if you're in a hot spot and you're going to and from the house and you have a multi-generational family, then you might want to consider it. But at the same token, remember, the hand washing, social distancing, all that inside the house can be equally effective if, again, you have those conditions set up like we talked about.
What COVID test is most accurate?
So the question is, what COVID test is most accurate? And there's a little primer on tests because there's a lot of them out there right now. Basically, two different categories. One are the diagnostic tests that tell us if we have COVID right now, and the other are antibody tests that tell us if we had it in the past and now we have antibodies built up that potentially could protect us from getting it again, but potentially being the key word there. So putting the antibody tests aside right now, looking at the diagnostic tests, there's a variety of those as well. The original one that came out was called PCR, polymerase chain reaction. And basically what they do is they get the genetic material originally from your nose, but now they can get it from your throat, they can get it from saliva. They get that genetic material and it amplifies that genetic material so the test can then detect it. This is a test that usually takes a few hours to run, but if you think about it logistically, by the time you get swabbed, it gets collected with everybody else who gets swabbed that day. It gets sent off to the lab. It gets to the lab that night. The lab has a backlog from the day before it's trying to take care of, and that's why you're seeing these delays. On the average, and I talked to Dr. Giroir yesterday, we had a Facebook Live. I call it a series Doc to Doc. If you want to see it, it was a great one yesterday. You can go to NBC News Facebook page and it'll be there. But talking to him, what he said was that on the average, we're talking around 4 to 5 days for people to get their test results back. There are outliers, up to 12 days. We've heard stories of 22 days. And even he admits at that point, it becomes almost a useless test. And so trying to get that number down is important. But again, part of that's because of the backlog and the demand for all the tests that are going on right now. And so he's saying trying to get that demand under control and getting tests for people who need it and trying to find other tests, which we'll talk about in a minute, could be especially important. So that's the PCR test. There is the regular PCR test you can send to the lab, and then there's a rapid PCR test. The rapid PCR test is a test that basically takes 5 to 15 minutes, and it can be done very quickly. But again, it uses specialized equipment, and that equipment has to go to a lab. So that 5 to 15 minutes might actually be overnight. There are other tests that are 5 to 15 minute tests that are antigen tests. And what those tests look for is they look for little pieces of protein, the antigens that can flare up your immune system, those little pieces of protein from the virus. If they detect it, they say, yes, you have coronavirus. The problem is those little pieces of protein sometimes are hard to detect. If a person has a huge, what we call viral load, meaning they have a lot of virus there, then they're going to detect it much easier. On the other hand, if they have a low viral load, meaning they didn't have many symptoms or they're asymptomatic and their load of the virus in their body is low, it might not detect that. And that's why you're seeing these false negatives, as in the governor of Ohio, who recently had a false negative antigen test and he did a repeat. He had a false positive antigen test that said he had it. He did a repeat test that said he doesn't have it. And now they're doing a third test to verify whether he has it or not. But again, that antigen test, not as accurate as the other test, the PCR test. And basically the overall way to look at it, if you're getting the test back quick, it's not going to be as accurate as the tests that take longer, but it's going to be quicker and we can use more information with that. We have more information we can use. And the thing behind tests, you learn this in medicine early on, is as a physician, you don't order a test unless you actually are and can do something with it. And so these tests that are coming back 14, 16, 22 days later, there's not much you can do with that. And so those tests are almost becoming useless at that point. Whereas if it can come back in a day or two, then we have information we can use and we can work with. And so that's why they're trying to get that down. What they're also talking about is getting card tests, which are going to be point of care tests that are going to give you information right away. And essentially think about it. If you go to the clinic, if you go to the ER, and you think you have strep throat, you're going to get a rapid strep test. They swab your throat, they take it back to their lab in the ER, and they put it all together on this little card, and a stripe comes across. And one stripe says, if there's a one stripe, it says you have it. If there's a different stripe, it says you don't have it. Do the same thing with flu. It's the equivalent of the pregnancy test you can see, and they don't think it'll be these tests, the COVID test will be at home yet, but it's a quick test in your clinician's office. They can tell you right away. They can use them in nursing homes. They can use them for sports teams. There's a lot of different things they can do to use those. And so those are the tests that are coming very soon here, and hopefully we have those because they're going to be cheap, and they're not going to be as accurate as the longer term tests, but there are a lot of experts out there saying right now at this point, because of the pandemic and the way it's panning out, and again, those 4.9 million cases, what they're saying is we need to get a better understanding of this. And so at this point, we're more looking at quantity over quality. In other words, getting more tests out there faster can give us more helpful information than slower tests that are more accurate. And so that's what they're trying to produce right now, and that's what they're looking at right now. Let me see if there's any other questions.
I have had positive antibodies. What are my chances for long-term immunity?
So the question is, I've had positive antibodies. What are my chances for long-term immunity? And the honest answer is we simply don't know. And mainly we don't know because this virus has only been here for 7 months. We don't know, or at least in the U.S. for 7 months, we don't know how it's going to act. We don't know what it means inside our body. But here's a couple of things we do know. We know that depending on your symptoms, if they're mild, those antibodies don't seem to last as long and don't seem to be as robust as the quantity of them in your body as if you've had more moderate or severe symptoms. So the more severe your symptoms were, the more antibodies you're going to have, the more robust those antibodies seem to be. But by the same token, if your antibodies go away, we don't know what that means because at that point they're just testing these one things called IgG antibodies. They're not testing these things called helper T-cell antibodies. Helper T-cell antibodies are harder to test for, but those are the ones that are the more or less the sentinel cells of our immune system constantly looking out for coronavirus. If they find it, then they induce the immune system to develop those IgG antibodies to fight it off. So as you can see, it gets very complicated as to what all this means. We simply don't know at this point, and that's why you tell people, even if you've had it and you have antibodies, you still need to make sure you wear a mask. You still need to do social distancing, because we don't know how long it's going to protect you from others or others from you.
Our kids are going back to school soon and seem okay about it, but we know they're worried. How do we help them?
So our kids are going back to school. This is a great question. They're going back to school soon, and we know they're worried, but they might not be saying anything. As parents, how do we help them? And kids are that's very typical of children. And the example I'll give you is a few months ago, I actually had a question from some children that talking to them and asking them what they were concerned about. And remember, this was back in March time frame. What they were concerned about, their big concern is, would their parents die? And when you got down to it, you asking them why they thought their parents would die. And number one, had they talked to their parents about it? Absolutely not. These kids, these are like 10 to 12-year-olds. No, they were too worried about getting their parents worried, and so they were just suffering in silence. And the reason they thought their parents were dying is because a lot of experts, and myself included, were talking in the news about how the elderly were particularly susceptible to coronavirus and more likely to die. Well, you can imagine to a 10-year-old, a 35-year-old parent is elderly, and so they thought their parents were in that elderly group. And so we had to explain to them, no, we're talking about 65 and older. So, grandparents, great-grandparents are who we're worried about, not your parents so much. And that gave them a good sense of relief. So the same thing here. They might be going back to school and suffering in silence, not really asking those questions that they're concerned about because they're afraid to ask them. One, they're afraid of the answer, and two, they're afraid to worry you as parents because children do try to protect their parents on a regular basis. So as parents, what can you do? A couple of things. One, simply sit down and talk to them. What are you worried about? And if the answer is like, most kids, no, nothing, not worried about anything. Well, bring up a few things. Are you worried about going to school and getting sick? Are you worried about going to school and your teachers getting sick? Are you worried about your friends? Just ask those questions. But the big thing is to listen to your children and not to what I call pontificate, not to sit here and lecture to them, but listen to them about their worries and find out together information that you don't know. On top of that, if you want some good information, Nightly News has a series called Nightly News Kids. And next week on Thursday, we're actually going to answer kids' questions, what particularly they're concerned about going back to school. I'll be answering some of those questions as well. We don't have the questions yet, but I'm pretty sure the questions are going to go along the line of, I'm afraid to go to school. Should I be worried? I'm worried about my friends. I'm worried about my teacher. Those types of things that kids are worried about. But the main point is, just sit down and talk with your kids. And some families might have kids with a variety of age. They might have 8-year-olds, 12-year-olds, and 17-year-olds. Sit down and talk with them at their levels and make sure they understand where you're coming from, what your thoughts are, and what science is showing. And again, this is definitely a time for facts over fear when it comes to talking to children. So please make sure you do that. This weekend's a great time to do that, especially if they're heading back to school, and alleviate some of their concerns, some of their fears. Let them know the schools are doing a good amount of work to try and keep them safe. You can even go to school websites and find out what they're doing, state websites, and find out what they're recommending, even the CDC website, to say, hey, here's the recommendations, here's the things that are going on, and here's the things you need to do to stay safe, to keep you and to keep us safe. but that way you answer their questions. But these are all been fantastic questions. Thank you very much. As usual, you guys have really done phenomenal, giving me great questions to answer. But going over the headlines again, numbers, 4.9 million cases, 160,000 deaths. The models are showing, at least one model, that by the end of the year, 300,000 deaths. But the same scientists are also saying if 95% of us wear masks when we're out and about, then they could cut that number of deaths down by 70,000. Face shields, looking into face shields, they don't seem to work as well as masks. They can offer some help, but they're not a substitute for masks. And then cancer cases and heart attack cases have dropped over the past few months, but not for a good reason. They've dropped because people are either ignoring them or not going to the hospitals because of them, because they're afraid of coronavirus. But you definitely need to go in, you need to take care of your health and realize that hospitals, clinics, doctors' offices, and ERs are doing everything they can to keep you and to keep them safe. So thank you very much. I hope you have a fantastic weekend. And as always, for you and yours, hope you stay happy, hope you stay healthy.